Good evening, everyone.
Good evening.
Good evening, and it's a pleasure to have you all here today on ADMH first web conference on impact of COVID on digital uh, branding, marketing, and business models of healthcare. Uh, we all know and understand these are very unprecedented and difficult times. Both the institution and the patient, they are all challenged with the ways in which we are currently expecting to interact, in the ways we are expecting the unexpected, and there is a lot more associated with it. The biggest problem lies in the fact that we don't know how soon this will get over. So with this, it was very critical, very important for us as a fraternity to come together and figure out how this is going to impact the way digital brands are going to survive in the healthcare brands are going to survive in the coming era. To throw a little light on this, we have with us some illuminaries from the best of the institutions in the country, and we hope to bring together some best knowledge. Before we move to the session, and I hand it over to Mr. Gopalakrishnan Ramchandran, who is the moderator today. I wish to have some hygiene for you. There is a Q&A on your screens. So when you wish to make a question, just feel free to write the questions there, and the moderator will pick up from there to ask the question to the panelist. We have the dignitaries introduction on the screen in front of you. You will be able to understand the depth of the experience and the knowledge that we have brought together. We welcome you to join the ADMH fraternity. ADMH is one of the growing fraternity of marketers in healthcare. We intend to actually come together to learn, grow, experience the learnings from the stalwarts in terms of how can we do better in the healthcare world. Over to you, Mr. GR. Let's have a great session ahead.
Thank you, Rahul. Good evening, ladies and gentlemen, and respected dignitaries. It's indeed a pleasure to be part of this very important conference on healthcare marketing, branding, and business models. We couldn't have had a better topic post the COVID-19 era. I would say post the COVID era. I'm hopeful that the COVID-19 will pass through, just as other catastrophes that pass through, and we have come out resilient and strong. One thing is for sure, healthcare marketing and branding and business models have changed like never before. The world has been upended. Healthcare will no longer be looked at with the same lens. It'll be looking at things differently. New models have to be worked out in terms of revenue. Customer engagement has to be a keen area of activity. Digital marketing for healthcare has to be something which is taken pretty seriously. Customer engagement has to be something which we just don't talk about, but we listen, comprehend, understand, and then we implement the feedback that we get diligently so that systems, processes, practices, and hygiene, housekeeping, and safety all are taken cognizance of in the post-COVID era to ensure norms like social distancing and sanitizing become key operational words which are used after the corona crisis passes through. We have to be vigilant against this virus. Healthcare marketing has a very different role to play now because marketing in healthcare has been a virgin territory. We can always say that if we enter the healthcare system, one white coat looks just like the other one. All people in white coats look similar, but then there's a big difference. We have to be unique. The hospitals have to render services which are unique. They have to be distinguished by the customer service. They have to be distinguished by the second opinion consultations that they give through remote management, online consultations, second opinions, and teleconsultations will be the name of the game. We'll not have crowding in hospitals as ever before. It has to be something where we will be upending the way we work, the way we live, and in a sense, the business model also will undergo a pivot. Technology will play a great role. AI, AR, VR, and ML, all these look to be alphabets and words, but artificial intelligence, virtual reality, artificial reality, and machine learning will help healthcare marketing in a big way. And big data analytics is going to tell us how the history records are maintained and how we give patients the best service. And more possibly, we'll have electronic health records being updated in such a fashion that privacy is maintained, secrecy is maintained, confidentiality is maintained. At the same time, we are going to be seeing that, yes, patients get the service at their doorstep quickly, fast, efficient, quick, clinical, and with a humane touch. And possibly the new era has arrived. Maybe COVID has forced us to recognize that we have to be more caring, we have to be more vigilant, we have to be more careful, and healthcare marketing becomes ever important than ever before. Together with that, technology as an enabler, robotics as an instrument to be used actively will play a great role. And today, we are going to talk much in detail as we have got a galaxy of experts who have assembled here with us to talk about various aspects, starting from marketing to branding, to changing the business model, to looking at customer engagement, to looking at electronic health records being maintained. And I am going to be now, without much ado, going to be handing over the mic to a very, very illustrious person who has been a friend of mine, and we have been speakers in the past, several forums in the past, Joy Chakraborty, who is the Chief Operating Officer of Hinduja Hospital and who has been spearheading the hospital operations with vast experience and responsible expertise, is now going to be sharing his thoughts in his opening brief remarks, followed by the other eminent speakers, and then we'll have a question answer session to be followed. It's going to be lively, entertaining, and exciting, I assure you all. So please be clued in and be with us throughout this seminar. Over to you, Joy. Welcome to the show.
Thank you, Jia, and good evening to all the viewers who are watching this digitally. As Jia has mentioned about the COVID-19 impact, and it is very important from the marketing, branding, and business models for the hospitals or healthcare sector. I'm going to touch upon the aspects related to hospitals specifically. And when I say that, I mean really a provider's space in healthcare. He's facing an unprecedented challenge. And what kind of challenge it is? We, especially in our scenario, are present in this hospital sector for last 7 decades. People, they have a lot of trust, faith, and we have developed millions of patient families as a part of the extended hospital family. But during this COVID-19 situation, what is happening? We are constrained to interact, share information, treat them the way it was happening before. And as a result of that, some sorts of, issues related to the connectivity with the patients, the treatment, what is supposed to happen for the patients, are facing a lot of challenges. What are those? Those who are new to the hospitals, I must say, most of the hospitals in the country as of now are OPD or outpatient departments are closed. Many of the hospitals have shut down their inpatient services for the elective cases, and that has resulted a huge pressure on the overall health system, that how do you manage these patients who are not COVID patients but their life are also precious, and how they take care of their health, who has dependent on you for last several years and decades. Suddenly they are facing a challenge of not getting the similar support in the current scenario. So keeping all this in the mind, the positioning of yourself as a provider becomes very important. GR has mentioned some of the you know utilities, features, what we are adopting, like teleconsultation, which is ensuring that during this challenging time, patients still remain in touch with the patient doctors. We are keeping, hospitals are divided into different zones to ensure that all the needy and deserving people are attended by the providers. And use of robots and all, I'll come to those later, have been picked up to ensure the hospitality part when a patient is visiting in the hospitals are remaining uninterrupted, and they can get the similar level of service during their visits also. So in this background, the marketing for hospitals is going to be very important from the point of view that what kind of communication, what kind of messages you are giving, how you are positioning yourself. Because in the market there are a lot of mistrust is already there about the chargeability, about the practices, about the professional etiquettes of the physicians, which I need not to elaborate much. But during this time it is becoming furthermore. And as a result of that, already in the media, already in the market, you will see that a lot of people have been, a lot of hospitals have been challenged, a lot of hospitals' name has been tarnished, the brands have been, unnecessarily blamed because of something. But I must say, being a part of the industry, that it is not that always the hospitals are in the wrong foot, and sometimes they give the clarification, justification, but that doesn't hold much value, because by then the name has been tarnished and the explanation doesn't go around to the target audience in a suitable way. So when you have challenge in terms of getting your patients, managing your business, you need to come out with different innovative business models. And some of those are like your telemedicines, as GR was again mentioning about electronic health records. That is going to be a major game changer. I am sure, though India is very late adopter of the same, but the way Western world has taken into consideration, when we take this through electronic medical records and disease management, some of these techniques will help us to keep our patients who are chronic patients like diabetes or hypertension to be away from the hospital, but still we can manage their problems in a better way. So this is an evolving scenario, and in this evolving scenario, everybody is trying to respond and react in a way which becomes good for the target market, target audience. And I'm sure this is revolving, and over a period of time it will be normal. And we are very much habituated with one term now called new normal. So it may not be back to the same level of whatever we had 3, 4, 6 months back, but I'm sure slowly it will start coming back. And with these innovative business models and a suitable positioning with excellent communication, these hospitals will get back their positions, and that will take our healthcare industry forward. So that is my introductory remarks, GR.
Thank you so much, Joy. It's been a pleasure to hear you and a joy to hear you. Let me put it very clearly. When you talk about taking care of patients, it has been so nice to hear that, yes, There is a challenge, but at the same time, you have to keep your calm. And I have understood very clearly in the past from you in my interactions how tough it is at times when doctors do a good job, but still the patients feel bad because they are the aggrieved party. And at that time, tempers do flare. And you put it very succinctly that we have challenging times. And yes, technology has to be adopted. And I think this is going to be the way forward. New normal is a word that's going to be used more often than not, Joy. And I think we are going to face a revolution in the technology and the communication world, as rightly stated by you. I'll be getting back to you with a question soon, Joy. We go to the next speaker right away, and that's going to be Colonel Ganguly. I hope Colonel Ajay Ganguly has joined us. Colonel Ganguly has
Yes.
Director Medical Services, Apollo Hospital, is here with us, and I'm sure Colonel Ganguly, being a services person in the past and having served the nation as an army person, is now serving the country through the healthcare services. And I think welcome, Colonel, to this wonderful show. And I'm sure that you'll give your perspective of how branding is going to help healthcare. Over to you, Colonel.
Thank you. Thank you so much. As you are all aware, prevalence of infectious diseases has increased globally as humans have spread across the world. Outbreaks occur frequently, but every outbreak does not reach a global pandemic level such as the end COVID-19 has. All pandemics have had significant social and economic cost to humanity over centuries. In 2009, the SARS virus spread from China. It was a zoonotic virus, and it spread to about 26 countries. Quarantine proved effective in control. Globally, health professionals started efforts to improve outbreak responses, and the lessons were used to keep H1N1, Ebola, and Zika under control. COVID-19 has, however, stretched healthcare infrastructure of even the most developed countries, and it is expected to cause an unparalleled recession. With the lockdown and travel restrictions that are in place, private care has seen a severe financial constraint despite having more than half of hospital beds in the country. The ENY report, which has been done for FICCI, shows an occupancy falling to approximately 20 to 30% of normal, with linked effects on operational costs, EBITDA, and cash balances. This has resulted in many organizations looking at fixed costs, including manpower, and searching for innovations to recover and recoup. The best defense against any outbreak is a strong healthcare system. However, this pandemic has shown us the fallibility of many systems globally and also the ability to function in a crisis. India has been quick to respond with major actions, including some which will happen in the future, such as faster implementation for activities of public health emergencies, which are part of the National Disaster Management Plan. Community awareness towards hygiene will have a major positive effect long term. Gaps in care, particularly clinical diseases or chronic diseases, will have long-term effects. Improvement of government infrastructure and strengthening of public and private practice partnerships. Importance of supply chain management and reservoir stocks. And of course, an improvement, what we will see, I hopefully see in with Make in India focus on equipment. Medical tourism, I think, will take a hit and will take some time to recover, at least in the short term. And of course, increase in the use of technology, telemedicine, emphasis, and on training. A lot of these activities will have an effect on how organizations brand themselves, and the ones which can brand themselves and show an effort to return to normal in a more agile manner are the ones that will actually make good in the post the COVID pandemic. Thank you. GR, I think you're on mute.
Colonel Ganguly, it was such a wonderful experience that we had from you and an exposition that you gave us. What I found very interesting is an army officer with a background of having been a sports personality and now working as a director of medical services is talking about EBITDA and fixed costs. Well, that was music to my ears. when I am a finance guy, and when I see finance and costs and strategy being spoken by an army man, I think, Colonel Ganguly, you hit the nail on the head. And to my mind, you conveyed exactly what is important in terms of a business model. And I must repeat it, that I was not expecting this welcome surprise from an army officer when he spoke about costs and control. Wonderful exposition for the healthcare department of divisions. And I think the viewers would have loved hearing you speak about costs, marketing, and healthcare technology that is needed post the COVID era and the data and the statistics that you gave. Thank you so much, Colonel Ganguly. We'll be getting back to you shortly.
Thank you.
We go to our next eminent speaker, Dr. Ritu Garg, Director, Forders Memorial Research. And Dr. Garg, are you there? Hello?
Yeah, yes, I'm here.
Okay, Dr. Garg, welcome to this seminar or a webinar. And we are delighted to have you here. And we are looking forward to hearing you from you. We would love to hear with the research angle given in, because as I see it, you are in the research part of the healthcare activity. So a research bent to it will be a really different take on the subject. And over to you, Dr. Ritu Garg.
Thank you, Jir. So yes, as everybody said, that it's been an unprecedented time for us. And I think what stands out more than anything else, to my mind, is the resilience and our ability to adapt and innovate. I think what we saw in last 6-7 weeks, when we were almost under the deluge of this pandemic, which demanded us to change our flows and innovate at every step. And that's 360 degree. So right from patient experience to administrative to workflows, all of it. And as you said about new normal, I think every organization today is drawing up a handbook for what new normal will look like. And we did the same. From the healthcare branding point of view and research point of view, I think the things that really help globally is one, that the industry came together across the globe. What we saw was how many of our clinicians, doctors, administrators actually got in touch with their peers from Singapore, US, London. It was everyday conversation in the clinician group as to learn what the best practices are. And that helped shorten the learning curve for everybody. I think India got the chance to get prepared much faster. One, because I think we're good learners and we are also able to replicate best practices. I know that some of the things that were, implemented in one hospital, I think within a day they got implemented in 10 hospitals because it made so much more sense. And I think the collective learning that we have had, either in terms of clinical protocols or social distancing norms, or in terms of the safety of healthcare workers, has been phenomenal. And when we translate this to provide value to the patient, that is where the paradigm of healthcare branding will shift for all of us. It's pretty much back to the basics as to what do patients value. So obviously, they always valued the clinical excellence. They valued the ability to deliver best medical care. But today, they also value the sense and the processes that give them safety within a hospital. I would like to share an example, and that kind of for us set what a healthcare branding would be. So we had one patient who was supposed to be taken up for a kidney transplant. And of course, we were debating that, with so many, corona patients all around, should we postpone it? And should we look at the guidelines? Can it be postponed? Can it not be? And their patients, he comes to us and he says, but you know what, I feel so much safer in this hospital because I see that you have everything under control. well, that is a big statement, and we just can't say that everything is under control. But at least what they saw, and they saw value in, was the fact that entire team was working to make the place safe in terms of screening, in terms of testing, in terms of disinfection, and that sense of safety and trust which was shown by that patient, I think is a testament to what the healthcare branding and marketing would look like even in future. So how we learn from each other and also adopt the best practices, be it in clinical research, be in clinical treatment protocols, be in technology, adoption of telemedicine, adoption of automation, robots. I think it's the entire process altogether. And in the end, if all healthcare facilities and hospitals are able to deliver that value to the patient, that he or she is in safe hands, and we do care for his or her safety along with delivering the clinical outcomes that that the patient has come in for. I think that is what will be instrumental in this new normal, in the new world. It's no longer about one parameter, it's about the whole 360 ecosystem that we will have to work at. You're mute.
So sorry. Ritu, thank you so much for this wonderful thought process that you gave just now. More importantly, talking about a paradigm shift, a 360-degree change. And more importantly, what you said made a lot of sense in terms of the clinical research or the clinical management. The testament is going to be in clinical outcomes where the patients are feeling satisfied, contented, and safety and security and hygiene and housekeeping are all taken care of, and the new normal becomes the normal for the future. And I think, Ritu, what you spoke about, I think in terms of research, in terms of technology, innovation, robotics, I think the paradigm shift and the 360 degrees is what's going to be etched in my memory for a long, long time to come. Thank you so much. I'll get back to you shortly. And now I go over to the next speaker, Mr. Guru Panja, Head Marketing and Sales, Sakra World Hospital, comes with loads of experience, and I would love to hear Mr. Panja share his experience about how he sees post-COVID, the aftermath of the COVID, how he sees the world changing in healthcare marketing. Mr. Panja? Hello?
Hello.
Is Mr. Panja there? Over to you.
Yeah.
Welcome, Mr. Panja. Over to you.
Yeah, you can hear me?
Yes, very well.
Okay, yeah. So it's Punja. That's how.
Sorry, I'm Punja. I stand corrected, Mr. Punja.
Yeah, that's fine. Good evening to all the dignitaries and all the people who have glued in for this webinar. So I come from a purely marketing and branding background. I heard a lot of seniors speaking about the operational challenges, overall scenario in India, the way things are going to be pre-COVID and pro-COVID, and a lot of debates and a lot of discussions are going around the world. So what I'm going to do is that stick to core marketing. That's my forte.
Lovely.
And I think today in healthcare, everybody is looking at marketing as the ray of hope that these guys will bring in the numbers back and hospitals are back to their so that's how I look in that thing. So just a brief in terms of healthcare marketing. I think one of the statement made by Mr. Gopal Krishna a couple of minutes back is that marketing in healthcare is a virgin territory. I beg to differ a little bit. I've been in marketing from, I think, 2020 when I was part of Wokhart those days. Marketing has evolved. Yeah, so my marketing has evolved. From those days it was very orthodox, and the scope of marketing in healthcare was very, very limited. Marketing was all about connecting to the referral doctors community, talking about what kind of clinical infrastructure a health hospital has and how the referral community can benefit by sending their patients. It was more of a clinical sort of a platform we had with the referral community. We had a very minimal engagement with the corporates. Those days, it was more of wellness sessions, what we used to do with all the corporates in terms of talking to them in terms of preventive aspects. We should talk to them of how do we prevent heart attack, how do we have the best diet in system. So a couple of topics were there. All the communication materials was very limited to magazines. The outdoor communication was limited to some hoardings and all those things. It was a very limited opportunity we had to talk to our customer base or patients. It got evolved in the last couple of years. The entire healthcare is just talking about digital marketing, and in fact, the entire team of in most of the healthcare hospitals, the traditional marketing team has been replaced by the digital marketing team. That's the way ahead. What has happened also is that from a personal interface, we have moved on to a digital interface sort of a process. Earlier, it was a very personal connect a hospital is to have with this customer base. That can be the referral doctor community, that can be corporates, that can be your neighborhood, community in large. It was far more personal. Things got changed into digital where, yes, the reach is much bigger, the scope is much bigger, but whether it is effective, whether what we are trying to do through the digital, is it really making sense? I still feel that we can debate on that, but right now in the current crisis where COVID has taken, everybody in healthcare is talking about COVID. So in my hospital, from security to the CEO, everybody is worried about COVID. And as marketing, my worry is that if we are 30% occupancy, my OPDs are closed. How do I now bring this back? And like all of you said, the new normal is that it is going to stay. It may be there for 6 months, it may be there for 8 months, it may be there for 1 year off. It may be there with us. You never know. It's a tough time. So from a marketing point, what I would like to say is that I think what's very important from a brand person is to rebuild the brand, get that assurance back to the patient that we are very safe hospital, and it's absolutely okay to come to a hospital. So that's a very important aspect. And one more thing, which are the two things which today I think will become the base for the entire post-COVID management in terms of marketing. One is how effectively we are able to communicate about what hospital is doing and how effectively we are taking care of patient safety. And from a marketing point, it's how we communicate about these two factors we will take the lead in terms of the way healthcare marketing is going to be defined for the next couple of months till this COVID is going to be there. So yeah, this is what I would like to share from my desk. Thanks.
Thank you so much, Mr. Punja. What I found very interesting and ironical in your topic and your speech, very interestingly, you said that the OPD is at 30%. Normally, we are looking at keeping patients healthy, and you want 30% to go to 100%. That means we want 6 people to come in a lighter vein so that your revenue model goes up. Having said that, I think you made a point there very well, saying that, yes, the OPD has to go up to 100%. So I found it to be ironical, yet that's true. Second, I take your point about when you said that marketing, healthcare market is not a virgin territory, but where I was meaning, and you re-emphasized, was that earlier it was orthodox. We knew hospitals by doctors. Doctors actually related to hospitals, as you rightly stated. And today, hospitals are becoming brands, and we are having professionals manning it. And the digital marketing world is now canvassing to make hospitals branded products. So I think, Mr. Punja, you created a very interesting model here when you said that your job is to bring in numbers. I was quite faintly amused that you have to bring in numbers means you have to bring in the patients so that you have the revenue. But that was an interesting observation post-COVID that you have to take it up. Thank you so much for the insightful thoughts that you gave on marketing and the numbers that you have to bring in as a marketing person, and how people after COVID have to be looking at new things and patient engagement, which will ensure that the hospitals are brimming with activity, ironical though it may sound. I will be getting back to you, and In the meantime, we will go to our next eminent speaker, who happens to be Rahul Rosha, co-founder of Novik. I hope I pronounced Novik rightly. And Rahul, I think that as I see it, it's more a startup. I've been in this field of startups, so it looks to me a very fascinating thing to know how a startup is realigning itself in this post-COVID era. Over to you, Rahul.
All right. Can everybody hear me?
We can hear you. We can't see you.
Yeah, unfortunately, we've got some technical glitches, so I've had to abandon my laptop and switch to a old-fashioned monitor. So apologize.
That's bad indeed. People can't view you, see you talking. We can only have the audio on, it seems. Please go ahead, Rahul.
Yeah, so first of all, I'd just like to thank everybody for the opportunity to be with such a distinguished audience this evening. So thank you all, and great. It's a pleasure to be here. Like you were saying, we are in a very interesting proposition. So just to give a very quick top line, so Novik Health was started in 2016. We are a very innovative startup in that we are focused on type 2 diabetes reversal, which many people or most people believe to be a chronic progressive disease. So we've had not just the challenge of establishing and creating a market, but also being able to hold a leadership position within that market. And then, of course, COVID happens. And as everybody who's come before me has said, it's a transformational time. And for us, yes, it does seem at times that it is moments of crisis, but we equally see tremendous upside and opportunity in this so-called new normal that we're all beginning to see. There are some very important lessons that we've learned as we've emerged and gone through this crisis. And I know we'll speak a bit more about this later. But number one, we do believe that branding has become even more important. The ability to connect with consumers in new and different ways, to be seen as trusted advisors and advocates, to be able to nurture those relationships has become extremely important. We think it's also a question of innovate or die. So at moments like these, there is a natural inclination for companies to scale back. They scale back investment, they scale back their workforces, and they sort of shrink in terms of their overall ambitions. But what we believe is in this situation, innovation is the name of the game, and it has to be targeted, focused innovation. So in our case, for example, we are looking at new offerings, which hopefully I'll get to talk about later, that are in sync with the state of the consumer and the state of the market dynamic as we see it currently. We are looking at new channels to distribute our products and offerings. We have doubled down on improving our expertise. We've in fact filed 3 patents in the last month alone. And we have also, in this era of scarce cash and scarce resources that any one given organization has, been able to nurture a series of partnerships both in India and abroad to make sure that we keep our innovative edge alive. So we definitely see the challenge that lies in front of us, but we'd like to focus more on the opportunity and more as seeing this as a transformational moment where we can really upend the traditional status quo and really establish ourselves as a leader in this emerging space. With that, I'd like to yield back the time and would love the opportunity to answer a few questions later on.
Thank you, Rahul. That was very, very clearly and explicitly brought out in terms of what you said, innovation focus. Focus on innovation is what you spoke about. And you double down on resources. I heard it very clearly. In this day and age of post-COVID, when people are scaling down, you are increasing your resources. You're not going to hold back on costs. You're going to scale up. You have launched patents. And I think what was interesting to hear is you are expanding with innovation as a focus in these uncertain markets. And I'm sure with a focused mind and a strategy in place, fortune favors the brave. Rahul, wishing all the best to you. And at the same time, I'll be getting back to you to ask some specific questions later in this session on diabetes, which is irreversible. So till then, I'll be back with you in a few moments. I'll be going back to the other eminent speakers and starting with my question answer session with them. Thank you so much, Rahul.
Thank you. Thank you.
We have had a wonderful exposition by each of the speakers. It's been illuminating, enlightening, and all of them had one thing to say for sure, and that was innovate or die, change or perish, and more importantly, safety, security, hygiene, new paradigm shift, 360-degree reversals, and more importantly, patient and client engagement as a new normal is going to be the order of the day, and branding will be more important than ever before, with technology playing a very, very significant role in terms of ensuring speedy justice in terms of medication to the patients. Quick and safe and sound is what we understood from the eminent panel of speakers. With the opening statements having been completed, and I'm sure the audience have loved it, we go over to each of the panelists with specific questions. And I start with Joy to ask him about, my question to Joy is going to be that in this era of change and technology that has taken place, teleconsultation has been the go-to method for patients to avoid visiting hospitals. How is it convenient? And how is it going to be done in order to provide a seamless transition for patients to have the same experience as they would if they were coming to the hospital by remote advice?
Thank you, Jia. And as I was mentioning, some of the technologies, some of the new normals which are started taking shape, and one of those is this teleconsultation business. Earlier, when things were normal, there are few hospitals, there are few providers who were following this teleconsultation business, but it was really a business in the sense patient when they are geographically far away and they find it difficult to travel, and at that time this method was followed. But currently there is no option. Even if a patient is 3-4 miles away, they are required to undergo this for a simple reason, otherwise the outpatient department is closed for most of the hospitals. Having said that, I must say during this time of crisis, what I didn't know before, I have come across close to a dozen of companies which are not known to me. They have approached that they have a powerful solution for this teleconsultation. And when I have gone through most of them, may not be all of them, I have seen more or less the products are same, and we have also taken one of those solutions for our own outpatient department management. When I say that in this situation, this may be acceptable. Some of these solutions have got extensive features where patient's records can be seen by the doctor, patient's other details can be accessed, a prescription can be digitally sent to the patient with the doctor, which are very much important from the medico-legal point of view. And also I want to say that soon after this lockdown, in Maharashtra at least, the Maharashtra Medical Council, they have given relaxation to this telemedicine or teleconsultation process earlier, which was not accepted to prescribe medicine without seeing a patient. Now this is okay going on. I don't know how long they will keep this relaxation for the hospitals, for the doctors, but even if it is continuing, I have couple of reservations from my own point of view. The first is, you know, 30 years, 40 years back, even though all of us were much younger and maybe our parents have taken us or they were the patients, at that time always the thing which was mostly appreciated, when a doctor comes and checks your pulse in his own, you feel some sorts of relaxation, you feel some sorts of happiness that the doctor has taken time and checked me, has put the stethoscope on my chest and checked the sound whether it is normal. But in absence of this, maybe the clientele or the consumers are also changing, but I think that kind of thing will be still missing, which will go in a long way from the patient engagement, patient satisfaction point of view. Secondly, if you think about a patient base of different classes, different strata, you can't expect each and every one of them to suddenly adopt the similar kind of platform in no time and avail the similar kind of service, which will lead to a difficulties in terms of getting your all segments of customers in the same platform to avail your service. So we have to think about it, but it has got several positive aspects in it. It gives a lot of flexibility, and I have seen currently, earlier when the clinic time was for 2 hours, now when doctors are under lockdown, they need not to travel, they have extended their clinic hours in virtual mode, and as a result of that they have increased the ability or capability of seeing more number of patients. It will
Thank you,
require
Joy.
it
I
will
think it was very interesting what you're talking to us. And I would say that this is something which we will see as a change that is coming in this near future. And the human touch that you are talking about has been a very critical thing that you have mentioned. We have to see this transition taking over sooner than later. Surely, I think so. That's going to be very, very important. Thank you so much for this wonderful reasoning and answering for this question that we had, because this is going to be very, very important for people to understand how the transition is taking place. I go to the next panelist, Colonel Ganguly. How do you see Indian healthcare industry has been a major sector in terms of providing to the nation in terms of volumes and numbers? How do you see the growth in this pandemic era and post this era?
During the era, obviously, I mean, a lot of people have spoken about the fact that the patient footfall has dropped. A lot of electives were not happening. So there was a lesser workload that happened for a long time. Other panels have also spoken about the OPD footfall coming down and things like that. You used the word the new normal. So I think during the pandemic, I think certain things are going to become a new normal. Okay, we'll start with something like basic hospital infrastructure. Since the importance of an infectious disease has come to the forefront, possibly some specialities may get more significance, may get more importance. We're likely to see possibly some infrastructure changes in hospitals as to how patient flow occurs to make sure that patients are safe and cared for. Over here, of course, we're keeping the basic principle at the back of our mind that it's always going to be patient first. We are going to see a lot of role for technology, whether it's IT, whether it's telemedicine, whether it's teleconsults. We've had an amazing notification which has come in where telemedicine, teleconsults and teleprescriptions, which are something that was in the pipeline for over 2 decades. It's this pandemic that has suddenly enabled. The government has been positive enough to take this and has put through this act, which came up just a couple of weeks ago. But this work on this act has been going on with a very dedicated group for about 2 decades, and it's finally come through now. So this is possibly a sign that the government are going to be a little more proactive in dealing with the healthcare issues, and particularly with issues related to outbreaks.
Thank you so much, Colonel
One thing
Ganguly.
which I did wanted to speak about was where the growth occurs is on the role of hospital operations. We have spoken about the losses and trials that hospitals are facing. But while people are looking at manpower costs and things like that, I think that's a little short-sighted to look at, because you cannot reduce your key manpower to deal with this kind of problem. The patients are there, the patients will come. But I think it puts a lot of pressure on hospital operations to address issues, to make the whole flow more efficient and to reduce wastage. It's good for the hospital, it's good for business, and ultimately it is going to be good for everybody concerned. And of course, the final thing is on infection prevention and control, something that is very important in hospitals and particularly tertiary care centers where transplants occur. But these are critical things which will make benefit for patients and will of course go a long way to keeping the bottom line down. And I think this is what will again take a lot of, should take a lot of impetus from healthcare organizations to keep this down.
Thank you, Colonel Ganguly. And it was very, very illuminating the way you answered the question. I think the viewers would have loved it. I am going to go over to Ritu. And Ritu, you're on the line?
Yeah.
Okay, Ritu, my question to you is more, I look at it that COVID is not the first challenge that was faced by the public and may not be possibly the last challenge. How do you see the future post-COVID, and how do you see the public reacting, and how do you see things panning out? Because if other things are coming, how are we to be equipped, or how do you think we need to be equipped?
Yeah. So as you rightly said, this is not the first public health emergency or a pandemic. I think what will happen is that we will get smarter and adopt it in our way of life. Now, to give you a parallel of what happened when HIV was one of the infections that were identified about 2 decades ago. What it led to was a transformational in healthcare industry. So the healthcare industry moved from glass syringes to disposables. And HIV led to an era of adopting universal best practices in the hospitals. So we all learned to be more careful with needles, making sure that every healthcare worker has gloves on. It led to a lot of changes in blood bank because the carrier was through the blood. So the net testing came up, the concept of window period came up. So there was a whole host of safety measures that were adopted by all hospitals in that era to ensure the safety from HIV. And I think this similar shift is going to happen now. So what we have done and what we will continue to do is that we are now going to make multiple barriers, because we all know that SARS kind of illnesses can be there. We had swine flu, we dealt with that. There have been different kinds of respiratory illness outbreaks. And now with Corona, this will become normal. So what will change? One, we will have universal best practices everywhere. Just as today we screen HIV and hepatitis C for many patients during surgery, the COVID testing or an antibody testing will become a norm. Just as we started using gloves, I think the use of masks will become a norm for all healthcare workers. All OPD chambers, the billing counters will undergo a change. We have put in acrylic glass and plastic shields, to minimize the level of exposure of both the patient's attendants as well as our staff. So that will become a norm. It will become a norm, that the OPD chairs will be spaced out. The patients will come with OPD appointments to reduce the overcrowding. What I'm trying to say is that we will learn to live with it, and we will adapt our way of working to ensure the safety with this pandemic. I also see that, with this, there's a lot of innovation happening in the OTs. So we are looking at how do we make our surgeons safe with aerosol generating procedures. So what I see is that going forward, there will be many negative pressure isolation rooms, both in the rooms as well as in the OTs. It will become a parallel. If I have to now plan the expansion of our hospital, I will make sure that we have adequate arrangements of negative pressure isolation rooms as well as ORs. So it will change completely to build in the safety that we require to be able to deal with these patients. So when you have one first episode of a patient who's not a suspect but gets tested positive, there is mayhem, right? Because you're running, everybody's running, trying to find out, do the contact tracing, so and so. But it will change to a point where we know how to deal with it. So no longer will it be panic. Okay, yes, there is a patient who was unexpected but has come positive. Okay, we will know how to deal with it in much more contained way. We would have evolved our contact tracing. We would have minimized the exposure to that patient, so that even if the patient or a healthcare worker or attendant is positive, it's not transmitted. And I think that way of working will become normal, and it already is. It already is. I mean, I think many people have adopted a lot of measures very quickly. Be it the use of PPEs, be it the use of screens, masks, hand sanitizers. In couple of months, I think we would learn how to minimize the transmission and at the same time continue to work. And I think that is what we need to get to.
Thank you, Ritu. I think you used two words, adapt and adopt. And I think that's going to be something which has to be done both by the patients as well as by the health care sector. And I think this is something where a new normal is going to be prevalent, and we'll become familiar and we'll be using it as a way of life, and it'll become part of a habit, like going in the morning and having a bath or brushing our teeth. It's going to become some sort of our normal activity in the future. Thank you so much, Ritu. I will be going across to Mr. Punja and asking him, branding in healthcare, how important, how critical it is for survival.
So I think the way we will look at the branding in healthcare is going to change, or is already changed in the last couple of days. The purpose of branding pre-COVID was very different, and the purpose of branding during this period of COVID is very, very specific. I think the objective is to ensure that we are able to connect to our patient base in terms of what as an hospital we are doing, which is very, very important. Second, what are the patient safety awareness or the patient safety aspects of hospital which they need to know, and how branding is able to connect that is something which will be a very, very important part of branding in the current situation. So what and how is something which we need to answer. Key, what are the things which we need to do from a branding point? One is absolutely is that to create awareness among the general public, create awareness among the patients who have experienced you, create awareness among the healthcare workers who are part of your system. That becomes a very important part of branding. Second, and a very crucial factor, is reliable and credible information. Today, I think in a period of COVID-19 and in the era of WhatsApp, universities and all those things, you get a lot of information on COVID management, a lot of information on symptoms and treatment plan. And I think as a healthcare provider, it becomes our principal responsibility to ensure that we give the right information, we get reliable information, which is really helpful for a general consumer, is really helpful for a patient who has different chronic conditions. I mean, in the past 6 years, Sakra would have treated thousands of patients, and they are finding it difficult to connect to our doctors. They're finding it difficult to come to the hospitals, and this is the time where, as branding, as a communication tool, we are trying to connect with them with the right information. It can be a cardiac patient who wants to know that I can't come to the hospital, I can't meet the doctor, what precautions I need to take. It can be a stroke patient who wants to understand how do I take care of my stroke conditions, post the surgery, or I'm just at home. Or it can be a chronic diabetic patient. There are multiple clinical conditions where patients would like to know update from the hospitals, would like to know update from the treating doctors, what they need to do. So this is where branding will come into a picture in terms of their communication mechanism and communication tools. What also is important from branding point is to build that assurance among the patient that we are safe, for example, at Chakraborty Hospital in Bangalore, and we are one of the few hospitals who have been identified for COVID testing by the government of Karnataka. How prepared we are doing that? Today we are talking to different healthcare providers that we are ready in case you have somebody who requires some kind of COVID support. We are always there, and this assurance is not only to my patients. This assurance is given to all the patients across healthcare. This again will come under a branding portfolio. How we are able to do that? So this is something which I feel is currently what branding need to do. And how do we do that today? Because of lockdown, because of limited ability to move around, we need to communicate. And how do we do that? And I think, as I said a couple of minutes back, I think digital communication is the route. And I like Sakra, all the hospitals are using different digital platforms to connect to their patients, connect to their consumers. Of course, you have a website which is a very interactive platform. For example, at our website, we have updated a complete mechanism or a system on COVID in terms of symptoms, in terms of what they need to do, in terms of precautions, in terms of the myths, in terms of the facts. Everything is updated. We have been creating multiple interactive platforms like webinars and Facebooks where our doctors are connected to general consumers or our patients in terms of giving information about COVID. We have created multiple very specific messages through our WhatsApp route where we are speaking exclusively to our patients. We are speaking exclusively to our neighborhood community as hospital what we are doing from a safety point, from a hospital update point. So to conclude, what I'm trying to say is that today branding in a COVID situation is all about communication, all about right communication, and how this communication is going to benefit both general consumer as well as your own patients who've been there with us for quite some time.
Thank you so much. Yes. Thank you so much, Mr. Punja. And we go over to Rahul to understand how, Rahul, you've been using a unique technology for diabetes reversal program and your business model, and being innovation focused has been your key parameters as a startup, and how you're going to take it forward in this post-COVID era. Over to you, Rahul.
All right, thank you. So that is actually a bunch of questions rolled into one, but I'll try and be direct and to the point.
Thank you so much, Rahul.
You're welcome. So I think the challenge for us pre-COVID was to build awareness around diabetes reversal as a legitimate standard of care and establish a leadership position. Now, what we have seen given COVID are changes, fundamental changes in consumer behavior. So as you look at the Indian consumer and even cast a wider glance internationally, we've seen three phases of the pandemic, from escalation, accumulation to early recovery. And what we've been doing in terms of innovation is we've invested in original research to understand the pulse of the diabetic in the current situation, and we've gleaned significant insights into what their motivations are, what their key purchasing motivations are, and we've designed products to cater to those specific needs. So aside from offering the traditional diabetes reversal program, we've started programs on boosting immunity, because that has come up as a significant concern with diabetics, because they're at a greater risk of developing serious complications. So we've had product innovations that we've rolled out. We have established new channels, given that trust is an important factor. So whether it is partnering with established providers to give us that credibility and that branding, or whether it is partnering with nutritionists to get the word out and increase awareness and get closer to the customer, we've been doing that. We've changed our business model. We've adopted a very light variable cost structure. We've developed innovative partnerships that allow us to bring expertise to bear on a variety of topics related to nutrition, which is really, at the end of the day, our core area of expertise. It is really using therapeutic nutrition and behavioral coaching that we reverse type 2 diabetes. So we made inroads in that, and we are in the midst of publishing new articles to again boost awareness, build our brand, given our competitors who've started to maintain a somewhat lower profile. We've done the opposite. And like I mentioned upfront, we've tried to bolster our capabilities and punch above our weight through establishing very select both Indian and international partnerships in critical areas surrounding our core offering. So those are the kinds of things that we've been up to that we believe position us well in this COVID environment.
Thank you, Rahul. Rahul, a quick, on a lighter note, this doctor in front of you is a doctor of medicine or a doctor of PhD in the management part of it?
It's the PhD.
I thought a doctor's there doing diabetes reversal program. Interesting combination, huh? A doctor to the booth. Thank you so much, Rahul. We go over to Swapnil. Swapnil will be addressing the answer to the question, how AI, ML will help in branding and marketing. Over to you, Swapnil, for your insight.
Thanks, Gia. Thanks for such a relevant question. I've been hearing all the challenges what the entire healthcare industry is facing on, and probably I am the one who probably can be a little help to everyone in that kind of a scenario.
Surely.
And artificial intelligence, NLP, like natural language processing, machine learning, and voice. I mean, this is a match made in heaven now, and this is the future of business. So let me bring a perspective on how like AI ML can help healthcare industry to make a future marketing. And I'm really so passionate about this particular area is because I come from a doctor family. My entire family is a doctor. And I was the one who did not wanted to be the doctor and moved out into the marketing side of it. So for almost 17 years odd, I've been into the sales marketing technology. So now I understand the doctor, healthcare, as well as the technology both very nicely. That's how it is. Now, in the recent time, I've been like talking to many of the webinars all about the AI and all, and we started getting almost 10 calls daily that how do we really be in touch or stay connected with our patients, with our customers, and that's really a difficult job. So, just want to let you know, like at Aura Robotics, we have been working into modern business conversational platform for almost 6 months now, and we build one-on-one interactions, conversations with the customer in such a way it goes very personal. So that's where the advantage is what we have been doing in the robotics and helping healthcare industry as well. And when it comes to the like technology and the artificial intelligence in healthcare market, there's a huge functions in AI, but here specifically when we are talking to in the space of marketing and all, I've just quickly brought in 5 major pointers which can help us to understand that how the entire industry can benefit from it and we can implement it. So if I divide the journey of a patient or any customer in a cycle, that the first is a reach, then we go and connect, when we do engage, and then finally we do the conversion and the retention. The is much detail. I can go more and more detail into these every stage. The industry is something there who is aware of how digital marketing is working, how this every phase of this journey can be driven by AI. There are there's some
confusion.
I'll just mute someone who. Sorry. So at every stage, every phase, there are an AI tools and technologies which is helping in terms of amplifying the performance of whatever you do today. And when Mr. Punjal said that website becomes one of the core things. When they bring everything to the website, everyone comes to the website. I mean, amplifying your website with the AI tools will make a lot of difference. And I'm not sure if the healthcare industry is aware of and is much known about the fact that the digital marketing from a content marketing, influencer marketing has been now changing completely to the conversational marketing. And the conversational AI is like something which helps a one-on-one relationship, a one-on-one connect with the audience on the virtual platform. So finally, everything boils down to a very important shift in the marketing, branding, and business model is to adopt the modern marketing techniques, the modern marketing platforms, and the ability to connect and communicate with the patients on the automated channels. And the automated channel, I mean, we know that the WhatsApp has been one of the very, very important channel and widely adopted channel across the globe. I'm not sure if everyone is aware about that. You might have received tickets from like my trip, my shows and all that. It's a verified account from where you receive these information. The similar business, it is called like WhatsApp verified business APIs. Now, this APIs can get integrated with your applications, and the patients can receive notification, other details, appointment details over the WhatsApp within verified accounts. So they know that they are talking to the authentic people, authentic hospitals, or the healthcare industry. So just, I mean, a technology, a disruptive technology when it comes to, we have been into the discussion with many of the people in the hospitals and healthcare. The one, if I can do automated WhatsApp two-way conversations, which predominantly was not there. And that's where I came in the picture, and we have cracked that code of having two-way conversations. So now, as a bot works, you can have the conversation, you can have digital marketing on Facebook, Insta, Google, you do that. The moment somebody connects from there, they immediately get connected to your WhatsApp. And from WhatsApp, you can do other two-way conversations. And again, you don't need a human to do that. We train the bots in such a form that the conversation is happening on real basis with WhatsApp, over the WhatsApp, and the engagement is phenomenally good, which the final experience comes out. So just quickly couple of points on what WhatsApp Verified Business API plus AI chatbots like Orion all deliver to the healthcare industry. You can automate and engage all your leads conversations. You can automate and scale up your engagement rate a lot. Automatically validate the numbers and the patient intent. I mean, the patient is coming who just wanted to know something. I mean, the question which was raised by many of the panels: is it safe to come to the hospital at this point of time? This is a question which somebody just wants. So it's not necessarily he would like to call, you try to figure out who I call the reach. If you reach to your website and just engages with your virtual agent, it just gets the answer right there. Send the notification to your WhatsApp API and then send the next appointment details if you have them. It gives you the entire perspective from the AI, ML, and the disruptive technologies which are coming up and can help the healthcare. That's what from my side was. Jia?
Jia, you have to unmute yourself.
I mean, I think Jia is stuck. His screen is stuck.
I'll just contact GR and figure out. Meanwhile, I think we can move to the second round of conversation. So let me just pull the data set. Give me a second. So we have the next set of interaction with on the topic of technology in healthcare. And let me invite Mr. Joy Chakraborty to talk about how technology has shaped healthcare in irreversible ways. How do you think innovations like electronic health record has added convenience and access to information? Over to you, Jia. Over to you, Mr. Joy.
Yeah, thank you. So The technology has definitely contributed in a big way. So far, we have heard that clinical technology was leading the clinical care models, but I can tell you the non-medical areas, whether it is in some of the cases I heard about AI, some of the applications we have adopted in our own hospital, that has driven the diagnostics part of it very significantly. Whether it is non-clinical activities like patient engagement, patient payment mechanism in different platforms, those have given a significance, it has improved significantly the patient experience in this scenario, not this scenario, even prior to that. But when you talk specifically about the EMR, I want to tell you this EMR has not been adopted in India in such an extent what is needed, especially for after considering the size of the population what we have. What we don't have the complete population database in terms of their health condition, their profile of health. And in absence of that, what we start doing lot of duplication of diagnostics as well as treatment part, which could have been avoided. Today, a patient, if they move from one hospital to the other hospital, they don't get to know their records, whether it has been shared in the other place, and they become subject of repetition of certain of these activities. So EMR can take that away in a long way. And I can tell you some of the chronic diseases I heard about, diabetes management and all, in some of those areas, this can work nicely. It can improve the patient's quality of life. It can reduce the number of turning patients turn up in the emergency room, for the simple reason that when through this technology you keep a track of this patient health, then many of these emergencies can be avoided. And finally, to add the EMR thing, if a hospital, if a healthcare provider wants to know their customer, wants to optimize their business, the most important thing they need kind of patients they are getting, from where they are getting, and how 2 or 3 different clinical specialties are getting overlapped, and how this each one of them are joining hands with the other specialties, and how that can be managed in a better way in the hospital. And EMR can do all this. And I'll take a small example before I stop in terms of this COVID treatment. In COVID, initially everyone was thinking and talking about it is something to do with lung infection, people will get respiratory disorders, and then they are going, some of them are going to ICU, they need. But slowly it has been seen it also affects and impacts other organs. It can cause problems with kidney. It can happen to a patient who had a prior disease or prior something else as a diagnosis. So when there is a presence of EMR can give seamlessly the information to the care provider about the prior ailments, about the prior disease condition, as well as can manage the present condition significantly. So that's all from my end, and I'm sure this EMR will come up in a significant way in our country also.
I think this has helped, healthcare systems worldwide, and with the changing times, it becomes more and more important to have healthcare records falling in place. Let me ask Dr. Ritu, because she's short of time and she has to exit the event at 6:30. Dr. Ritu, in your view, how telemedicine is going to, affect the way administrations are happening, the billing part, the human resources part? How do you propose the use of geolocation to follow traces, etc.?
So
Ritu, I'm back. Rahul, I'm back.
Oh, thank you,
Telemedicine
sir.
solves the problem. Thank you so much. I'm back with you all again.
No problem. So I just covered with Mr. Joy, and now I moved
Joy,
to
my
Miss.
apologies. I couldn't be there to hear your exposition because you had a slightly lesser time in the previous part when I had intervened. So I hope you got your time this time.
Yeah, I got it. Thank you.
Okay, Joy. Ritu, over to you.
Yeah. So thank you, Rahul. I think the use of geolocation and, telemedicine is actually, government is showing us the way. I think Arogya Setu app is the best example of how you can use geolocation. Well, yes, of course, I'm not here commenting about the privacy issues and stuff like that, but we know that geolocation can help us understand the demographic profile of a disease in a particular location. Now, from a healthcare point of view, I think that also becomes very important. So when we start using our telemedicine, if there is a call which is coming in from a containment zone, from a red zone, then your reactions can actually be different than where it may be from other zones. And I think this is not just about this COVID outbreak, but it helps us to understand where the patient is calling from and what does the disease profile look like. We all know that there are different endemic areas across the world for certain diseases. So you would have prevalence of X disease in a particular location much more than any other. It could be to do with genetics, it could be to do with season. So our ability to pick that up is better if we start using geolocation. The second would, of course, be that with the use of telemedicine and remote connection, we are reducing the number of human interactions, which is much required in today's world. What that means is that everything is contactless. So what we are trying to do is that we are mapping the patient journey and saying that how do we make it completely contactless? So patient is sitting at home, they call us through telemedicine app, whatever platform that any of us are using. You understand where the patient is calling from. The payment happens before. Now, during the teleconsult or video consult, if the doctor feels that the physical examination needed, even then there is a confirmed appointment which is shown at the gate. So they just scan the appointment, and this is what the future will look like. And you just walk in. So everything is contactless. You just go in, land in front of the doctor, and in fact, some people do video consults within the facility as well. So everything will move to automation and contactless and being contactless, and that is what we are going to use for our patient journey. Mute. JR, you're mute again.
Thank you so much, Ritu. It was a pleasure hearing you, and I think you are in a hurry to leave. We'd have loved to have you for the complete session, but I'm sure we'll be offline again. We will be in touch with you. It was wonderful to hear you about the contactless process that we're going to have.
Thank you.
And I think I'm looking forward to interaction with you in the near future. Thank you so much, Ritu, for joining us.
Thank you very much. Thanks.
Okay. We go over to Colonel Ganguly, and we will be speaking about EHR adoption, electronic health records. Is it possible? Is it happening? Are we slow? How do we go about it? Over to you, Colonel Ganguly.
Thank you, JR. Electronic health records, of course, are something that have been around for a long time. It's an area which has tremendous people dependency. Obviously, IT, who will be designing the system, and from healthcare, people obviously have to be involved in the design and need to be committed to the usage of the system. An ideal HIS or EMR, EHR should have the ability to be used across devices, should be possibly adapted to off-site usage. It will need a lot of attention to forms and formats, to ease of data entry, convenient dashboards. Obviously, the issues of security and confidentiality are important and will need to comply with existing laws as well. It will need to deal with some lag time for training of people who are going to be using it. Ultimately, AHRs are a culture of change. I mean, paper records have been available for ever since possibly healthcare started. But an EHR must go through a culture of change, because not everybody is comfortable using or documenting it, and healthcare workers unfortunately are very notoriously for poor documentation of whatever they do. So any EHR implementation plan must have the vision, must have the skill sets from people. It possibly may have some incentives, resources have to be made available, and must have a plan for implementation. In India, somehow EHRs have always undergone some kind of resistance, mainly from healthcare. There has possibly been an issue of communication between the people who are making the HIS and people who are on the user end of the HIS. What possibly COVID has shown us now that this is going to become more and more important, since we've spoken about geohealth and AI and machine learning and things like that. It is possibly going to become more and more imperative that healthcare organizations start using EHRs. People, the frontline users, frontline providers of healthcare will have to come to terms with the fact that this is something that they will have to do, something that they will have to get into, will have to do the data entry properly. And I think it's just something whose time has come. It's something that is more or less inevitable, possibly with this pandemic in a shorter time frame. Thank you.
Thank you so much. It was, as usual, insightful and illuminating. I'm going to go to Rahul now to ask him how machine intelligence is helping healthcare providers to fight the pandemic, how the COVID problem has already changed healthcare technology, and what's next, Rahul, in this journey?
Certainly. So let me start by talking a bit about where we are seeing the impact of AI and related technologies right now. So when you look at the population level, I think somebody earlier was talking, I think it was Ritu, who was talking about government efforts at contact tracing, being able to predict potential hotspots, being able to project where there might be a sudden upsurge in terms of the pandemic, marshalling equipment, projecting where there would be need for ventilators and other PP, personal protective equipment. That's another area where AI is being used. Certainly in terms of vaccine development, in terms of identifying potential vaccines to pursue further, drugs that may hold promise against COVID-19. So those are some things that AI has been intricately involved with at the population level. Certainly at the individual level, there have been various efforts to equip individuals to do risk assessments, whether it is in terms of the risk of catching the coronavirus and avoiding those risks, or whether it is the risk of developing serious complications if you have an underlying condition. So those are all areas where AI has been a significant contributor. I think when you look ahead, there are a few different areas where you can see AI emerging and playing a bigger role. So certainly in terms of vigilance efforts and spotting future pandemics and being able to virtually cordon off certain geographies is a lesson that one has learned through this current pandemic. So AI will be deployed in the future. I think another trend that will get accelerated, which is certainly happening in the Western world, is the personalization of medicine or precision medicine, as it's called, where treatments would be tailored and personalized to your individual conditions. We have also spoken about telemedicine taking off, and that certainly looks like a trend that's here to stay. But I think one of the other underlying related areas is this notion of remote continuous care. So for example, in our own company, when people enroll in our diabetics program, we use mobile apps to monitor the enrollee 24/7. And that is going to be a trend that is only going to accelerate as the Internet of Things sort of gains adoption, as more point of stay devices become available to monitor temperature and other vitals. So we think remote continuous care will also become significant. I think all of these are positive developments. The one area that stands out as one of potential concern is when you look at apps like Arogya Setu and others in other countries, there is a lot of personal information being collected, and there is this legitimate fear of us and other countries possibly turning into surveillance states. So that is another area where AI can be used or / misused in terms of not being able to protect patient privacy to the extent that's necessary. But I think in general, net being able to spot and control future pandemics, personalized nutrition, and remote continuous care, those would be the sort of big trends that I see coming up.
I think, Rahul, it was wonderful to hear you talk about the pros of technology as well as the concerns of technology invasion in our privacy and surveillance coming into the system. I think it was a very, very valid point. Privacy is very important. Confidentiality is important. Technology is there for us to take us to the next century. But at the same time, if it becomes surveillance states, yes, if it is going to be intruder on our privacy, we do have cause for concern. But I'm sure these things will be addressed in due course of time. But surely technology as an enabler will be there in the system. Now we come to Swapnil to quickly get into and tell us very briefly, we've already spoken about AI in great detail, very briefly that how this technology is going to be ML, AI, AR, VR are going to help us in a big way in the coming period in the healthcare and fraternity.
Right, thanks, Gia. I'm not switching on my video. Last time, I think I got a message saying that there was some issues in terms of the voice break. Just wanted to confirm, is my voice coming clear now?
Now it's coming clear. You're right.
Perfect. You're right. So the question what you have asked is very relevant. And as the world is talking about AI, any new marketing strategy needs to be implemented only if you are able to engage with the prospective patients, probably the current patients or the outpatients or the old patients. I mean, there are few tools you must actually have in your website to adopt the conversational marketing, which is the new trend, which has to be adopted by the healthcare industry. So I'm sure many of you have heard about the AI chatbots. Like, it is an AI tool that serves as an alternative for the live chat or human interactions. And we know that we will be avoiding human interactions now. So chatbots can simulate conversations with patients. Today, healthcare use them in the patient connect functions to answer basic questions and connect with a live doctor if necessary. So just from a chat, you can initiate a video call or a chat with a doctor. I mean, a telemedicine, telehealth, what we have been talking about can also be part of the AI chatbot, which is installed on your website, which is on your social media, which is on your advertisements, much there. So that's one of the major thing which everyone should be adopting for in the healthcare industry. The next big trend, what we have been talking from a digital standpoint, is a voice AI. The voice AI can connect with users at each phase of the patient journey and help them engage with the hospitals, clinics, doctors easily. I mean, the voice assistants are the bots powered by AI. So voice recognition and natural language processing to help answer questions and hold the conversational audibly. So again, it maintains the distance and you can still be doing everything what you are doing in the physical ways. So the conversational marketing is only possible when hospital clinic starts by making your website and WhatsApp business as your central hub. So for anything you do in the digital world, these two things has to be your central world now. Your website is your face of the organization or your healthcare setup, as well as WhatsApp is the channel to communicate. So each individual from multiple online marketing channels, those who are connected, should be able to do a conversation with you absolutely with ease. I mean, so finally, AI, natural language processing, machine learning, or voice is the future of the healthcare marketing, and we all should be adopting it. We can definitely talk about it as much as you can say. Thank you, Jia.
Thank you, Swapnil. Thank you, Swapnil. It was indeed a very interesting conversation that we have had on the questions that have been raised and the answers given by all the eminent panelists. All that I can say is that we heard a lot of things which were very insightful. I'm sure that the viewers have also heard a lot of things which were really good. And in the process, we have understood two things very clearly. One, that technology is here to stay to enable healthcare. Marketing in healthcare is going to be there. All the panelists concurred in the view that healthcare marketing is going to be preeminent. Business models will be upended. It'll be having a pivot, and it's naturally so. Post-COVID, we'll see very many changes. New normals will be there. Client interactions will be more intense, maybe not personal, but yet we will try to make it as personal as possible and contactless. And in the process, we'll be having what we term as the new dispensation in place in order to ensure that our activities are safe, sound, privacy is maintained, confidentiality is maintained, technology is used more than ever before, customer engagement is at its peak, and people have the best medical and health facilities, and branding becomes very important with a humane touch. With this, we have had a wonderful session of views, questions, and answers, and I hand it over to Rahul for his concluding statement. Thank you so much. Over to you, Rahul. Jay.
Thank you so much, GR. I think you played a pivotal role to, help channelize the energies, the tremendous experience we had on this particular panel. So it was so nice of you to be able to, help us drive the conversation meaningfully, such that, people can take the best value out of this, meeting. Thank you so much, each panelist. Each one of you has been, great resource today. We had 340 registrations and close to 250 plus people attending this session. At this peak itself, we are also seeing close to 180 people still live, wanting to know and understand more from all of you. So, I mean, it has been a very, very insightful session. Just to bring in, the perspective of ADMH again, the mission under which we organize this particular session, I request your patronage. And I seek support from all the members here, all the audience who have, been attending this session today to join the group ADMH. The whole pursuit at ADMH is to drive the healthcare marketing and its dimensions. So we look forward to have support pouring in. We continue this journey. We are hopeful that on a month basis, we create some or the other intervention to help people learn and understand the importance of digital in healthcare. Thank you so much. And it was a great, it was such a great thing to bring together and learn and understand a lot of perspective that we got today. And I mean, I wish all of you a very safe lockdown period ahead. Thank you so much.
Thank you so much. Stay safe, stay at home. Bye-bye.